I'm Dr. Ross Perry. At Cosmedics, we sometimes get patients sending in some photos. Will's very kindly sent in a photo of a mole that has changed recently, and this is a picture of it. And as you can see, it's quite dark, and he's also described it as actually changing and quite new.
My name is Will. I am here today because I have got a mole on my foot which has grown in size and changed in colour recently, over about the last year or so.
So this is what we call a little dermatoscope. It's a little device that we use to basically just look at the moles, and it just helps us look underneath the skin. So if we just have a quick little look at this one, and I can take a little picture of it for you. So as you can see, that's your little mole there. Yeah. So what the things is that we're looking for with this is basically the colour, the depth of the colour, and any changes in what we call the architecture of the mole. And yours is very, very dark, and it's also very deep. So the fact that it's a new mole, it's changing, and it's different from any other mole that you have on your body. In my opinion, I think it would be better, just on the safer side, just to remove it, send it off to the lab, get it tested, and then we've got a bit of peace of mind that hopefully it's all okay.
Cool.
Okay. I'm just going to draw on you now. Okay. So we normally mark out a little margin around the mole to make sure that we've got it all out. And then we basically do what's called an ellipse excision for this. So that's basically where we're going to cut around it and ensure that the whole mole has been removed. Okay, sharp little scratch coming up. You all right?
Yeah.
Good, just sting a little bit as it goes in. Good, so that's the worst bit done, all right. So we've left the anaesthetic work for 5 or 10 minutes, and so what we're going to do is give it a quick clean, and all this does is disinfect the area so it's nice and clean. Good, nice and numb, yeah?
Yeah.
Good,
Yeah.
perfect, okay, so we're just going to start now. You okay?
Yeah.
Brilliant. As I said, the nice thing about doing these things is giving you some local anaesthetic means that it's you don't feel a thing, despite what we're doing. So that's what we call an ellipse excision. So we're just going to take it off the lower layers of the skin. Just got to be careful on the foot, just because there's fairly important structures underneath. There we go, so that's the specimen, that's the little mole we're going to send off to the lab and get tested. What we do now is cauterize the bleeding, so this just stops it. It's just a special radiosurgical device. And as you can see, very little bleeding from this, it's very nice. So we're going to put a dissolving stitch underneath the skin, and then a superficial stitch on the surface just to give it a bit of a beautification. Okay, so these are just very superficial, sort of deeper stitches, or deeper stitches for the wound. The nice thing about these stitches, you never see them, they just dissolve over probably 6 or 8 weeks. And how we're doing, you okay?
Yeah, all good.
Perfect. Good. So that has come together beautifully. Great. So all done. Yeah. So these are what we call Steri Strips. Okay, we're going to give you some of these to go home with. And so you just change them every 3 or 4 days. And the idea for these is that they just support the wound. So that again, the wound heals very nicely. So you just put them east to west across the wound under a tiny, tiny little bit of tension. This is just a little shower-proof dressing. Just goes over the top.
We're better off having a bath and keeping the foot out of the water.
Yeah, you can do that. Yeah, or just put your foot in a bit of a plastic bag, and that's it.
With the mole going off to the lab, what's the time frame for that?
So about 5 to 7 days. Right. So it gets sent from here to the lab. With moles like this, there's a grading system, and if you imagine, it's almost like a color chart. White is completely normal. Shades of grey is irregular. And then you've got black, which is skin cancer. So I suspect that this will probably be a light grey. Well, that's what I'm hoping it's likely to be. So the way that we've removed it, it shouldn't require any further treatment, but it's just precautionary to do that.
It was very easy. As said, I was slightly nervous beforehand, but Ross, who saw me, was excellent and it didn't hurt a bit. It took about 10 or 15 minutes and all done and dusted. So I've just come in to have my stitches taken out. As said, after my mole was taken out, it would be about 5 days to get the results, and that was bang on. So I got a message from the clinic saying that all was clear, that my mole wasn't a melanoma, and so that was a relief, obviously. And then spoke to the clinic, and we arranged an appointment to have my stitches taken out about 10 days after they were put in, all good. Everything has been very easy and kind of everyone's made me feel very comfortable. So in terms of recommending Cosmedics, 100%. It's all been great, and I'd highly recommend them to anyone that's looking to have anything done.